Florence Welch, the 39-year-old frontwoman of Florence and the Machine, recently revealed a deeply personal and traumatic experience in an interview with The Guardian. The singer, known for hits like Dog Days Are Over and Shake It Out, disclosed that she nearly lost her life in 2023 due to an ectopic pregnancy that required emergency surgery. The revelation, shared with raw emotion, sheds light on the physical and emotional toll of the ordeal and its lasting impact on her life and music. Welch's ectopic pregnancy occurred when she was 37, during a period when she was in an on-again, off-again relationship with a guitarist whose identity she has chosen to keep private. An ectopic pregnancy, as defined by the Mayo Clinic, happens when a fertilized egg implants outside the uterus, often in the fallopian tube, leading to severe complications like abdominal pain, vaginal bleeding, and potentially life-threatening internal bleeding. For Welch, the experience was both physically excruciating and emotionally devastating, marking a pivotal moment in her life. The ordeal began while Welch was preparing to headline the Cornwall Music Festival. On the day of her performance, she felt increasingly unwell, experiencing severe pain and heavy bleeding. "I looked pale and I was struggling, but I thought I could push through," she recalled. Her doctors advised her to seek medical attention after the show, and upon returning to London, she learned the severity of her condition. An ultrasound revealed that her fallopian tube had ruptured, causing significant internal bleeding. "They told me I had a Coke can's worth of blood in my abdomen," Welch said, her voice heavy with the memory. The situation required immediate surgery to remove the damaged fallopian tube, a procedure that Welch described as both terrifying and surreal. "I had this primal urge to run away like an animal instinct," she said. "But I was hooked up to machines with an ultrasound wand inside me, and a nurse I'd never met holding my hand. I couldn't go anywhere." During the procedure, Welch experienced overwhelming emotions, letting out a sound she described as, like a wounded animal. The trauma of the moment, coupled with the loss of her pregnancy, left a profound mark on her. Welch's health crisis forced her to cancel several UK tour dates in August 2023, a decision that initially sparked speculation about a foot injury. In a social media post at the time, she hinted at the true reason, stating that the surgery was for reasons she wasn't strong enough to go into yet, but had saved her life. Reflecting on the experience, Welch noted that if she had boarded a planned flight for another performance, the outcome could have been fatal. "I'd have come off that plane on a stretcher or worse," she said. The singer also opened up about the emotional aftermath, describing the loss of her pregnancy as devastating. She initially viewed her first miscarriage as a common occurrence, noting that her doctor had reassured her that such events, while heartbreaking, are not typically dangerous. However, the ectopic pregnancy was a stark reminder of how quickly things could escalate. "The closest I came to making life was the closest I came to death," Welch said, her words capturing the profound duality of the experience. She described feeling connected to a room full of women screaming, a visceral image that reflects the shared pain of those who have faced similar losses. Welch's music has always been a vessel for processing her emotions, and this experience has undoubtedly influenced her work. Her album Dance Fever, released in 2022, already explored themes of vulnerability and resilience, and she hinted that future projects may delve deeper into her journey through grief and recovery. "Creativity is how I cope," she said. "It's like building a mythology to make sense of the chaos." Her ability to channel personal pain into art has resonated with fans, who admire her raw honesty and ethereal stage presence. The ordeal also prompted Welch to reflect on her physical and mental health. The cancellation of her tour dates, while difficult, allowed her to prioritize recovery and process the trauma. She later returned to the stage, closing out the Dance Fever tour in Lisbon and Malaga, where she relied on her performances to find strength and catharsis. Her resilience in the face of such a life-altering event is a testament to her strength as both an artist and a person. Welch's decision to share her story publicly is a powerful act of vulnerability, aimed at raising awareness about ectopic pregnancies and supporting others who have faced similar experiences. By speaking openly, she hopes to destigmatize conversations around pregnancy loss and highlight the importance of seeking medical attention for concerning symptoms. Her story is a reminder of the fragility of life and the strength it takes to move forward after profound loss.